Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
A client diagnosed with acute pancreatitis 5 days ago is experiencing respiratory distress. The nurse should report which of the following to the healthcare provider? 1. Arterial oxygen level of 46. 2. Respirations of 12. 3. Lack of adventitious lung sounds. 4. Oxygen saturation of 96% on room air. The correct answer is 1. Manifestations of adult respiratory distress syndrome secondary to acute pancreatitis include respiratory distress, tachypnea, dyspnea, fever, dry cough, fine crackles heard throughout lung fields, possible confusion and agitation, and hypoxemia with arterial oxygen level below 50. The nurse should report the arterial oxygen level of 46 to the healthcare provider. A respiratory rate of 12 is normal and not considered a sign of respiratory distress. Adventitious lung sounds, such as crackles, are typically found in clients with ARDS. Oxygen saturation of 96% is satisfactory and does not represent hypoxemia or low arterial oxygen saturation. Which of the following is an expected outcome for a client with carbon dioxide poisoning? 1. A relatively matched ventilation to perfusion ratio. 2. A low ventilation to perfusion ratio. 3. A high ventilation to perfusion ratio. 4. An equal PaO2 and PaCO2 ratio. The correct answer is 1. In the normal lung, the volume of blood perfusing the lungs each minute is approximately equal to the amount of fresh gas that reaches the alveoli each minute. Blood gas analysis evaluates respiratory function. The level of dissolved oxygen should be greater than the level of dissolved carbon dioxide. The parent of an infant with a cleft lip and palate asks the nurse when the infant's cleft palate will be repaired. The nurse responds by stating that the first repair of a cleft palate is usually done at which of the following times? 1. Before the eruption of teeth. 2. When the child weighs approximately 22 pounds. 3. Before the development of speech. 4. After the child learns to drink from a cup. The correct answer is 3. The optimal time for a cleft palate repair depends on many factors. However, it is best done before speech develops and the child learns faulty speech habits as a result of the defect, usually before 12 to 15 months of age. Tooth eruption usually begins at about 6 months of age. The child should weigh about 22 pounds at 6 months, but the important consideration is to schedule surgery before speech patterns begin to develop. An infant may learn to start drinking from a cup as early as 6 to 7 months of age, possibly up to the first birthday. Which of the following should the nurse assess in a newborn diagnosed with an anorectal malformation? Select all that apply. 1. Abdominal distension. 2. Loose stools. 3. Vomiting. 4. Meconium in the urine. 5. Meconium stools. The correct answers are 1, 3, and 4. Anorectal malformations present with lack of stool or evidence of meconium in the urine through a fistula. Meconium is not found in the stool. Because stool does not pass, abdominal distension and vomiting occur. After surgery to correct pyloric stenosis, the nurse instructs the parents about the postoperative feeding schedule for their infant. The parents exhibit understanding of these instructions when they state that they can start feeding the child within which of the following time frames? 1. 6 hours. 2. 8 hours. 3. 10 hours. 4. 12 hours. The correct answer is 1. Clear liquids containing glucose and electrolytes are usually prescribed 4 to 6 hours after surgery. If vomiting does not occur, formula or breast milk then can be gradually substituted for clear liquids until the infant is taking normal feedings. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A prima gravida client is admitted as an outpatient for an external cephalic version. The nurse should assess the client for which of the following contraindications for procedure? 1. Multiple gestation. 2. breech presentation. 3. Maternal Rh negative blood type. 4. History of gestational diabetes. The correct answer is 1. External cephalic version is the turning of the fetus from a breech position to the vertex position to prevent the need for cesarean birth. Gentle pressure is used to rotate the fetus in a forward direction to a cephalic lie. Contraindications to the procedure include multiple gestation because of the potential for fetal injury or uterine injury, severe oligohydramnios, contraindications to a vaginal birth, and unexplained third trimester bleeding. If the mother has Rh negative blood type, the procedure can be performed and Rh immunoglobulin should be administered in case minimal bleeding occurs. A history of gestational diabetes is not a contraindication unless the fetus is large for gestational age and the client has cephalopelvic disproportion. The primary healthcare provider prescribes an amniocentesis for a prima gravida client at 35 weeks gestation in early labor to determine fetal lung maturity. Which of the following is an indicator of fetal lung maturity? 1. Amount of bilirubin present. 2. Presence of red blood cells. 3. Bar body determination. 4. Lecithin sphingomyelin. The correct answer is 4. To determine fetal lung maturity, the sample of amniotic fluid will be tested for the L/S ratio. When fetal lungs are mature, the ratio should be 2:1. Bilirubin indicates hemolysis and, if present in the fluid, suggests Rh disease. Red blood cells should not appear in the amniotic fluid because their presence suggests fetal bleeding. Bar body determination is a chromosome analysis of the sex chromosomes that is sometimes used when a child is born with ambiguous genitalia. For the past 8 hours, a 20-year-old prima gravida client in active labor with intact membranes has been experiencing regular contractions. The fetal heart rate is 136 BPM with good variability. After determining that the client is still in the latent phase of labor, the nurse should observe the client for 1. Exhaustion. 2. Chills and fever. 3. Fluid overload. 4. Meconium-stained fluid. The correct answer is 1. The normal length of the latent stage of labor in a prima gravida client is 6 hours. If the client is having prolonged labor, the nurse should monitor the client for signs of exhaustion as well as dehydration. Hypotonic contractions, which are painful but ineffective, may be occurring. Oxytocin augmentation may be necessary. Chills and fever are manifestations of an infection and are not associated with prolonged latent phase of labor. Fluid overload can occur from rapid infusion of intravenous fluids administered if the client is experiencing hemorrhage or shock. It is not associated with prolonged latent phase. The client's membranes are intact, so it would be difficult to assess meconium staining of the fluid. Meconium-stained fluid is associated with fetal distress, and this fetus appears to be in a healthy state, as evidenced by a fetal heart rate within normal range and good variability. The stigma related to having a mental illness, especially a chronic illness, persists despite improvements in the management of illnesses and an increase in public education. Which of the following views most perpetuates the stigma? 1. Mental illness is hereditary. 2. Mental illnesses have biochemical bases. 3. Clients cannot prevent mental illness if they want to do so. 4. Clients can recover from mental illness if they have willpower. The correct answer is 4. Many still believe that recovery from mental illness is a matter of willpower. For example, pull yourself up by your bootstraps or just get over it. This belief persists despite awareness that mental illness is hereditary and has a biochemical basis. Mental illness can be prevented only if there is early intervention. Clients cannot prevent it just by the desire to do so. Which of the following is a realistic short-term goal to be accomplished in 2 to 3 days for a client with delirium? 1. Explain the experience of having delirium. 2. Resume a normal sleep-wake cycle. 3. Regain orientation to time and place. 4. Establish normal bowel and bladder function. The correct answer is 3. In approximately 2 to 3 days, the client should be able to regain orientation and thus become oriented to time and place. Being able to explain the experience of having delirium is something that the client is expected to achieve later in the course of the illness, but ultimately before discharge. Resuming a normal sleep-wake cycle and establishing normal bowel and bladder function probably will take longer, depending on how long it takes to resolve the underlying condition. A client has the following arterial blood gas values. pH is 7.52, PaO2 is 50, PaCO2 is 28, HCO3 is 24 milliequivalents per liter. Based upon the client's PaO2, which of the following conclusions would be accurate? 1. The client is severely hypoxic. 2. The oxygen level is low but poses no risk for client. 3. The client's PaO2 level is within normal range. 4. The client requires oxygen therapy with very low oxygen concentrations. The correct answer is 1. Normal PaO2 level ranges from 80 to 100. When PaO2 falls to 50, the nurse should be alert for signs of hypoxia and impending respiratory failure. An oxygen level this low poses a severe risk for respiratory failure. The client will require oxygenation at a concentration that maintains the PaO2 at 55 to 60 or more. The nurse should place a client being admitted to the hospital with suspected tuberculosis on what type of isolation? 1. Standard precautions. 2. Contact precautions. 3. Droplet precautions. 4. Airborne precautions. The correct answer is 4. Airborne precautions prevent transmission of infectious agents that remain infectious over long distances when suspended in the air. The preferred placement is in an isolation single client room that is equipped with special air handling and ventilation, a negative pressure room, or an area that exhausts room air directly outside or through HEPA filters. Should be used if recirculation is unavoidable. On the second postoperative day after repair of a cleft palate, which of the following should the nurse use to feed a toddler? 1 cup, 2 straw, 3 rubber tip syringe, 4 large hole nipple. The correct answer is 1. A cup is a preferred drinking or eating utensil after repair of a cleft palate. At the age when repair is done, the child is ordinarily able to drink from a cup. Use of a cup avoids having to place a utensil in the mouth, which would increase the potential for injury to the suture lines. After teaching the mother of a neonate who has successfully undergone surgery to repair a low anorectal anomaly, the mother indicates that she understands her child's prognosis when she states which of the following? 1. My child will need to wear protective pads until puberty. 2. My child will need extra fluids to prevent constipation. 3. My child will probably always need a high-fiber diet. 4. My child has a good chance of being potty trained. The correct answer is 4. Children who undergo surgical correction for low anorectal anomalies, as infants usually are continent. Fecal continence can be expected after successful correction of anal membrane atresia. Therefore, this child probably has a good chance of being potty trained and will not need to wear protective pads. Extra fluids and a high-fiber diet are not required to prevent constipation. Children with high anorectal anomalies may or may not achieve continence. Immediately after the first oral feeding after corrective surgery for pyloric stenosis, a 4-week-old infant is fussy and restless. Which of the following actions would be most appropriate at this time? 1. Encourage the parents to hold the infant. 2. Hang a mobile over the infant's crib. 3. Give the infant more to eat. 4. Give the infant a pacifier to suck on. The correct answer is 4. Giving the infant a pacifier would help meet non-nutritive sucking needs and ensure oral gratification. Additionally, sucking aids in calming the infant. Holding the infant to decrease fussiness and restlessness is more effective in an older infant. Also, the reason for the infant's fussiness needs to be explored. Hanging a mobile over the crib frequently does not decrease fussiness. After surgery to correct pyloric stenosis, feeding the infant more formula would lead to vomiting, putting additional stress on the operative site. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A prima gravida client in the second stage of labor feels the urge to push. The client has had no analgesia or anesthesia. Anatomically, which of the following will be the best position for the client to assume? 1. Dorsal recumbent. 2. Lithotomy. 3. Hands and knees. 4. Squatting. The correct answer is 4. Anatomically, the best position for the client to assume is the squatting position because this enhances pelvic diameters and allows gravity to assist in the expulsion stage of labor. This position also provides for natural pressure anesthesia as the fetal presenting part presses on the stretched perineum. If the client is extremely fatigued from a lengthy labor process, she may prefer the dorsal recumbent position. However, this position is not considered the best position anatomically. The lithotomy position may be ineffective and uncomfortable for a client who is ready to push. The hands and knees position may help to alleviate some back pain. However, this position can cause discomfort to the arms and wrists and is tiring over a long period of time. Assessment of a 15-year-old prima gravida client at term and active labor reveals cervical dilation at 7 centimeters with complete effacement. The nurse should assess the client for which of the following first? 1. Uterine inversion. 2. Cephalopelvic disproportion. 3. Rapid third stage of labor. 4. Decreased ability to push. The correct answer is 2. Adolescent pregnancy carries an increased risk of pregnancy-induced hypertension, iron deficiency anemia, and CPD. CPD is a concern because maturation of the skeletal bones is commonly not complete in adolescence. Adolescent labor does not differ from labor in the older woman if no CPD is present. A prolonged first stage of labor and poor fetal descent may indicate that CPD exists. Uterine inversion, a rapid third stage of labor, or decreased ability to push may occur regardless of the client's age. A prima gravida client whose cervix is 7 centimeters dilated with a fetus at 0 station and in a left occipital-posterior position requests pain relief for severe back pain. The nurse should 1. Provide firm pressure to the client's sacral area. 2. Prepare the client for a cesarean birth. 3. Prepare the client for a precipitate birth. 4. Maintain the client in a left sideline position. The correct answer is 1. The client who has back pain during labor experiences marked discomfort because the fetus is in an LOP position. This pain is much greater than when the fetus is in the anterior position because the fetal head impinges on the sacrum in the course of rotating to the anterior position. Application of firm pressure to the sacral area can help alleviate the pain. Problems of severe back pain during labor do not typically require a cesarean birth. The primary healthcare provider may elect to do an episiotomy, but it is not necessarily required. It is unlikely that a prima gravida client with a fetus in an LOP position will have a precipitous birth. Rather, labor is usually more prolonged. A hands and knees position or a right sideline position may help to rotate the fetal head and thus alleviate some of the back pain. An elderly woman experiences short-term memory problems and occasional disorientation a few weeks after her husband's death. She also is not sleeping, has urinary frequency and burning, and sees rats in the kitchen. The home care nurse calls a woman's primary health care provider to discuss the client's situation and background, assess, and give recommendations. The nurse concludes that the woman, 1. is experiencing the onset of Alzheimer's disease. 2. is having trouble adjusting to living alone without her husband. 3. is having delayed grieving related to her Alzheimer's disease. 4. is experiencing delirium and a urinary tract infection. The correct answer is 4. Delirium is commonly due to a medical condition, such as a UTI in the elderly. Delirium often involves memory problems, disorientation, and hallucinations. It develops rather quickly. There is not enough data to suggest Alzheimer's disease, especially given the quick onset of symptoms. Delayed grieving and adjusting to being alone are unlikely to cause hallucinations. Which of the following should the nurse expect to include as a priority in the plan of care for a client with delirium based on the nurse's understanding about the disturbances in orientation associated with this disorder? 1. Identifying self and making sure that the nurse has the client's attention. 2. Eliminating the client's napping in the daytime as much as possible. 3. Engaging the client in reminiscing with relatives or visitors. 4. Avoiding arguing with a suspicious client about his perceptions of reality. The correct answer is 1. Identifying oneself and making sure that the nurse has the client's attention addresses the difficulties with focusing, orientation, and maintaining attention. Eliminating daytime napping is unrealistic until the cause of delirium is determined and the client's ability to focus and maintain attention improves. Engaging the client in reminiscing and avoiding arguing are also unrealistic at this time. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client has the following arterial blood gas values: pH 7.52, PaO 250, PaCO 228, HCO 324. The nurse determines that which of the following is a possible cause for these findings. 1. Chronic obstructive pulmonary disease. 2. Diabetic ketoacidosis with Kussmaul's respirations. 3. Myocardial infarction. 4. Pulmonary embolus. The correct answer is 4. PaCO2 of 28 and PaO2 of 50 are both abnormal. The PaO2 of 50 signifies acute respiratory failure. In evaluating possible causes for this disorder, the nurse should consider conditions that lead to hypoxia and hyperventilation, such as pulmonary embolus. COPD is typically associated with respiratory acidosis and elevated PaCO2. The client with diabetic ketoacidosis most often has metabolic acidosis. A myocardial infarction does not often cause an acid-base imbalance because the primary problem is cardiac in origin. A client has developed a hospital-acquired pneumonia. When preparing to administer cephalexin 500 milligrams, the nurse notices that the pharmacy sent cefazolin. What should the nurse do? Select all that apply. 1. Administer the cefazolin. 2. Verify the medication prescription as written by the physician. 3. Contact the pharmacy and speak to a pharmacist. 4. Request that cephalexin be sent promptly. 5. Return the cefazolin to the pharmacy. The correct answers are 2, 3, 4, and 5. One of the rights of drug administration is right medication. Cefazolin was not the medication prescribed. The pharmacist is a professional resource and serves as a check to ensure that clients receive the right medication. Returning unwanted medications to the pharmacy will decrease the opportunity for a medication error by the nurse who follows the current nurse. The parents report that their one-day-old is drooling and having choking episodes with excessive amounts of mucus and color changes, especially during feedings. The nurse should contact the primary care provider to further assess the baby and request a prescription for 1. A lactation consultation. 2. A blood gas. 3. An X-ray with orogastric catheter placement. 4. A serum blood glucose. The correct answer is 3. The drooling and excessive mucus production is highly suggestive of a tracheoesophageal fistula. The initial diagnosis is made when an orogastric catheter cannot be passed to the stomach. A lactation consult would be warranted only after determining feedings were safe to continue. While cyanosis can be a sign of sepsis and hypoglycemia, the cyanosis is most likely related to the excessive secretions and airway patency. A blood gas may be needed, but only after ruling out a TEF. When the infant returns to the unit after imperforate anus repair, the nurse should place the infant in which of the following positions: 1. On the abdomen, with legs pulled up on the body. 2. On the back, with legs extended straight out. 3. Lying on the side with the hips elevated. 4. Lying on the back in a position of comfort. The correct answer is 3. after surgical repair for an imperforate anus. The infant should be positioned either supine with the legs suspended at a 90-degree angle or on either side with the hips elevated to prevent pressure on the perineum. A neonate who is placed on the abdomen pulls the legs up under the body, which puts tension on the perineum, as does positioning the neonate on the back with the legs extended straight out. Which of the following behaviors exhibited by the parents of an infant with pyloric stenosis should the nurse correctly interpret as a positive indication of parental coping? 1. Telling the nurse that they have to get away for a while. 2. Discussing the infant's care realistically. 3. Repeatedly asking if their child is normal. 4. Exhibiting fear that they will disturb the infant. The correct answer is 2. The parent's ability to verbalize the infant's care realistically indicates that they are working through their fears and concerns. This behavior demonstrates an understanding of the infant's condition and needs. Without further data, the fact that the parents have to get away could be interpreted as ineffective coping, possibly suggesting that they are unable to handle the situation. Continuing to ask about the child's general condition even after answers have been given does not suggest effective coping. The parents are demonstrating that they are unsure themselves as parents or are hoping for positive information. Exhibiting fear that they will disturb the infant does not suggest effective coping. This behavior indicates that they are uncertain or lack knowledge about infants. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 21-year-old prima gravida client at 40 weeks gestation is admitted to the hospital in active labor. The client's cervix is 8 centimeters and completely effaced at 0 station. During the transition phase of labor, which of the following is a priority nursing problem? 1. Urinary retention. 2. Hyperventilation. 3. Ineffective coping. 4. Pain. The correct answer is 4. During transition, contractions are increasing in frequency, duration, and intensity. The most appropriate nursing problem is pain related to strength and duration of the contractions. Insufficient information is provided in the scenario to support the other listed nursing diagnoses. Urinary retention would be appropriate if the client had a full bladder and was unable to void. Hyperventilation might apply if client was breathing too rapidly, but there is no evidence this is occurring. Ineffective coping might apply if the client said, "I can't do this," or something similar. A 19-year-old prima gravida client at 38 weeks gestation is 7 centimeters dilated and the presenting part is at +1 station. The client tells a nurse, "I need to push." Which of the following would the nurse do next? 1. Use the McDonald procedure to widen the pelvic opening. 2. Increase the rate of oxygen and intravenous fluids. 3. Instruct the client to use a pant blow pattern of breathing. 4. Tell the client to push only when absolutely necessary. The correct answer is 3. Pushing during the first stage of labor, when the urge is felt but the cervix is not completely dilated, may produce cervical swelling, making labor more difficult. The client should be encouraged to use a pant blow pattern of breathing to help overcome the urge to push. The McDonald procedure is used for cervical circlage for an incompetent cervix and is inappropriate here. Increasing the rate of oxygen and intravenous fluids will not alleviate the pressure that the client is feeling. The client should not push even if she feels the urge to do so, because this may result in cervical edema at 7 centimeters dilation. A prima gravida client in active labor has had no anesthesia. The client's cervix is 7 centimeters dilated, and she is starting to feel considerable discomfort during contractions. The nurse should instruct the client to change from slow chest breathing to which of the following? 1. Rapid, shallow chest breathing. 2. Deep chest breathing. 3. Rapid pant blow breathing. 4. Slow abdominal breathing. The correct answer is 1. The psychoprophylaxis method of childbirth suggests using slow chest breathing until it becomes ineffective during labor contractions, then switching to shallow chest breathing, mostly at the sternum, during the peak of a contraction. The rate is 50 to 70 breaths per minute. Deep chest breathing is appropriate for the early phase of labor, in which the client exhibits less frequent contractions. When transition nears, a rapid pant-blow pattern of breathing is used. Slow abdominal breathing is very difficult for clients in labor. A client has been in the critical care unit for 3 days following a severe myocardial infarction. Although he is medically stable, he has begun to have fluctuating episodes of consciousness, illogical thinking, and anxiety. He is picking at the air to catch these baby angels fly around my head. While waiting for medical and psychiatric consults, the nurse must intervene with the client's needs. Which of the following needs have the highest priority? Select all that apply. 1. Decreasing as much foreign stimuli as possible. 2. Avoiding challenging the client's perceptions about baby angels. 3. Orienting the client about his medical condition. 4. Gently presenting reality as needed. 5. Calling the client's family to report his onset of dementia. The correct answers are 1, 2, and 4. The abnormal stimuli of the critical care unit can aggravate the symptoms of delirium. Arguing with hallucinations is inappropriate. When a client has illogical thinking, gently presenting reality is appropriate. Dementia is not the likely cause of the client's symptoms. The client is experiencing delirium, not dementia. An elderly client was prescribed Ativan 1 milligram 3 times a day to help calm her anxiety after her husband's death. The next day, the client calls her daughter asking when she is picking her up to go to the graveside. The client says she has been walking up and down the driveway for the past hour, waiting for her daughter. Noting the client's agitation, hyperactivity, and insistence, the daughter calls the nurse to report her mother's behavior. Which of the following would the nurse suspect as the cause of the mother's behavior? And what action would she suggest? 1. The client is manic and may need a sleeping pill. 2. The client is experiencing a medication interaction and should go to the emergency department. 3. The client is experiencing a paradoxical reaction to Ativan and should stop the new medication immediately. 4. The client is overcome by grief and probably needs an antidepressant. The correct answer is 3. Paradoxical responses to benzodiazepines are more common in children and the elderly than other age groups and generally occur at the beginning of treatment. Grief/depression in the elderly is more likely to result in fatigue and withdrawal than hyperactivity and agitation. Treatment with a sleeping medication, chemically related to benzodiazepines, is likely to result in an increase rather than decrease in agitation symptoms in elderly clients. A medication interaction is possible, but less likely since most pharmacies screen for drug interactions when filling prescriptions. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.